There is a lot of debate going on about aerosol generation during Phaco emulsification and whether the virus is present in the fluids of the eye or not. There are surgeons who presented articles and showed videos that aerosols are not generated during Phaco emulsification. However, there are also articles and video presentations showing that aerosols are generated during Phaco emulsification and the presence of virus in the eye fluids. With so many contradicting statements in mind, a clinician like me has a big dilemma of the dangers associated and the steps to be taken. When I put my brain into the problem, it gave me a simple innovation, the Corona Phaco tent. This gave me the desired safety to my surgical team, creating a physical barrier to the aerosols that are generated during Phaco emulsification. So what do we need to create this Corona Phaco tent? First, a simple rubber band is prefixed to the optic of the microscope as seen in this video. The smaller yellow bands seen help us to lift the main red rubber band when necessary. Next, we need a simple, sterile, clear plastic drape. Using a bit of the crafting skills, the plastic drape is kept sterile and a cut is created in the center of the drape as seen in this video. The 1.5 inch triangular piece cut in one corner of the double folded drape will convert into a circular hole in the center of the drape. The size of the hole should be equal to the size of the optic of the microscope. Meanwhile, regular draping of the eye with the eye towel and the regular Phaco drape is completed. Now, the concept is to fit the sterile plastic sheet around the optic of the microscope. I have taken the sterile 1 meter into 1 meter clear plastic sheet that we have cut previously, and the circular hole we created is aligned with the optic of the microscope with our sterile hands under the sheet. Now, our running nurse will help us fix the drape around the optic of the microscope with the help of the prefixed rubber bands, thereby making it airtight. My hands are under the sheet in the sterile part, holds the drape in position to help fix the sheet. Care is taken that the running nurse handles only the part of the sheet close to the microscope optic. Care is also taken that the running nurse does not touch the microscope caps. Initially, we can remove the caps to avoid any accidental touch. Once the sheet is fixed to the microscope, the edge of the sheet towards the surgeon are carefully positioned so that they remain sterile, and the outer edges of the sheet away from the surgeon are given to the running nurse to be dropped down just like the regular eye towel or eye drapes. As the microscope is positioned for surgery, it creates a Corona Phaco tent for us to operate with peace of mind, having a physical barrier to the aerosols created and this fluid spill from the eye during Phaco emulsification. Settling down for the surgery, we can see that we can move our hands freely in and out of the Corona Phaco tent and handle the microscope handle without any obstruction. All steps of Phaco emulsification can be completed normally without any problem, even for difficult cases like this hypermature cataract. All steps of the surgery like incision, dye injection, visco injection, capsular excise, even in such leaking cataracts, eyeball loading, eyeball implantation can be accomplished with ease. There is unobstructed view through the microscope of the surgical field throughout the surgery. All the maneuvers of phacoemulsification can be completed with ease. As our assistant cannot put balanced salt solution over the incision during phacoemulsification, we need to use viscoelastic over the cornea and the incision to avoid any possible phaco bones while dealing with hard cataracts. This is to show the ease with which the phaco probe or the irrigation aspiration probe can be taken under the drape so that the entire phacoemulsification can be completed with peace of mind. Examination of the drape can show that the droplets sticking to the inner side of the drape not spilling onto us. At the end of the surgery, the drape is simply pulled out and disposed properly and appropriately. This Corona Phaco tent can be modified providing a needle port to allow the assistant to put balanced salt solution over the incision, and an elastic band can be prefixed to the drape for easy assembly to the microscope. Corona Phaco tent is making our surgical team safe during phacoemulsification. It is very easy to make with the simple materials. It's easy to assemble by our running nurse, and as there is a physical barrier from the aerosol, our safety is guaranteed. I hope this simple innovation will help you all to operate safely in this corona pandemic time. Corona Phaco tent. Thank you.